Assalamu alaikum wa rahmatullah. The article of this week is titled Pulp Survival of Cracked Teeth with Reversible Pulpitis After Orthodontic Banding and Coronal Coverage, a prospective cohort study with 1 year follow-up. It was done by Seet et al. In 2024 and was published in the Journal of Endodontics. So there are several treatment modalities employed for the management of cracked teeth with reversible pulpitis in the literature. Some they used the bonded composite restoration, and other studies they used bidirectional supplanting and other modalities. So the aim of this study is to investigate the 1 year pulp survival of cracked teeth with reversible pulpitis managed with initial stabilization using orthodontic bands, followed by coronal coverage restorations. So for the materials and methods, 125 patients with a cracked tooth with reversible pulpitis each were recruited. Preoperative patient and tooth data were collected. After definitive pulp diagnosis were determined following an interim period of orthodontic banding, coronal coverage restorations were replaced. Cox and logistic regression analysis were used to assess possible prognostic factors and to correlate initial time to pulp stabilization while in orthodontic bands with eventual outcome. Then the pulp survival was determined using both clinical and radiographic findings, where the follow-up radiographs were compared to preoperative radiographs to assess for periapical changes. So out of 106, which has 1 year after orthodontic banding, 85 of them was vital and crown complete, which had 4 radiographic failures. And out of 106, 21 of them had root canal treatment indicated or initiated. So the pulp survival was 76.4%. So for the outcomes of treatment of recruited subjects based on the time taken for definitive pulp diagnosis, while teeth were in orthodontic bands, out of 106, which has 1 year after orthodontic banding, 75 of them pulp diagnosis determined at 1 month review, and 23 had 2 month review, and 8 of them had a 3 month review. For the 1 month review, 17 out of them they proceeded to crowns, and 5 of them had RCT initiated. And out of the 2 month review, 21 proceeded to crowns and 2 of them RCT initiated. And for the 3 month review, 4 of them proceeded to crowns and 4 of them had RCT initiated. So for the total pulp survival of the 1 month review, it was 81.3%, and for the 2 month review it was 73.9%, and for the 3 month review it was 37.5%. So the pulp survival, it was found to be highest amongst teeth that required a 1 month or 2 month period to achieve definitive pulp diagnosis in orthodontic bands by 69.6 to 78.7%, while teeth that required 3 month period to definitive pulp diagnosis only had total pulp survival of 37.5. So the pulp survival after a crown issue was higher compared to the total pulp survival for all teeth across the groups regardless of the time taken to definitive pulp diagnosis, which means that the number of teeth that required RCT through definitive crowns was reduced. The rationale for the interim orthodontic banding phases for cracked teeth where reversible pulpitis is hence twofold: to aid treatment planning by confirming pulp diagnosis, and to decrease pulpal stresses before further possible trauma through restorative effort. So for the limitations of the study, first of all, the crack lines were not eliminated, which the cracks are colonized by bacterial biofilms. Hence, some authors advocate the removal of crack lines. prior to the crown, or to remove the pulperitance. Secondly, there was no control group within this study. So in conclusion, the management of cracked teeth with reversible pulpitis via interim supplanting with orthodontic bands prior to coronal coverage restorations has been found to have pulp survival rates of 76.4% at 1 year. Root canal treatment is recommended for cracked teeth with reversible pulpitis that require more than 2 months to achieve a normal pulp diagnosis during a monitoring stage. Longitudinal monitoring of the pulp in step-by-step approach in the pre-restoration phase may confirm the reversibility of pulpitis for the treatment planning and reduce the incidence of root canal treatments required through definitive crowns.